Welcome to our video on deadly diseases. Today, we'll delve into the world of medicine and explore various types of illnesses that impact humanity. Ebola is a deadly disease caused by the Ebola virus. This ailment instills fear in anyone who encounters it. High fever, internal bleeding, vomiting, diarrhea. Just a small part of what an individual infected with this virus experiences. Ebola is transmitted through direct contact with the blood or other fluids of infected live or dead wild animals. In Africa, the virus can also be transmitted from animals to humans through the preparation and consumption of raw meat from wild animals. The scale of Ebola epidemics can be terrifying, as the rapidly spreading virus can engulf entire communities. And while scientists are fighting this terror, combating Ebola remains one of the most serious challenges for medicine and society as a whole. Bubonic plague, also known as the Black Death, is the most common form of plague transmitted by the bite of an infected flea. In medieval Europe, 2 out of 3 chances among 200 million victims would be affected by this disease. A passing rat could make itself comfortable on your straw bed, and within a week, you would become the new victim of the Black Death. The symptoms of this disease were extremely painful, including high fever, painful swelling of the lymph nodes, and severe fatigue. Without antibiotics, more than 70% of those infected died from this disease. It destroyed entire cities and spread so quickly that there were not enough survivors to bury the dead. Tuberculosis is a dangerous disease caused by the bacterium Mycobacterium tuberculosis. In the past, it was known as the White Plague due to its devastating impact. It's a disease that spares no one, as anyone can be its victim. Symptoms of tuberculosis include coughing, severe fatigue, weight loss, loss of appetite, and fever. The disease primarily attacks the lungs, but can also affect other organs such as the kidneys, brain, and spine. Without treatment, it can be fatal. In the past, tuberculosis claimed the lives of millions of people, and even today remains a serious threat to public health. Leprosy, also known as Hansen's disease, is a chronic infectious disease caused by the bacterium Mycobacterium leprae. Historically, this disease has been associated with notions of suffering and ostracism. Symptoms of leprosy may include the appearance of nodules, changes in skin color, as well as damage to the nervous system, which can lead to loss of sensation and limb loss. Leprosy is primarily transmitted through skin contact or breathing air, but infection is only possible in a small percentage of people predisposed to this disease. Thanks to the efforts of medicine and society over the years, leprosy has become less common, but it still remains a challenge for the medical community, especially in regions where it is still prevalent. Tularemia, also known as rabbit fever, is an infectious disease caused by the bacterium Francisella tularensis. This rare but serious illness is transmitted from animals to humans, primarily through bites from infected insects, contact with infected animals, or through contaminated food or water. Symptoms of tularemia may include fever, headache, muscle pain, as well as inflammation of lymph nodes and skin at the site of infection. Without prompt treatment, it can progress and lead to severe complications. Combating this disease involves preventing insect bites, practicing proper hygiene, and avoiding contact with potentially infected animals. Malaria is a severe infectious disease transmitted through the bite of mosquitoes infected with Plasmodium parasites. This disease is one of the most widespread and deadly in the world, particularly in tropical and subtropical regions. Symptoms of malaria can range from fever, chills, and headache to severe forms, including jaundice, anemia, and organ damage. Combating malaria involves preventive measures, such as using mosquito repellents and prophylactic medications, as well as treatment with anti-malarial drugs. Despite efforts to combat this disease, it remains a significant health threat in many parts of the world. Tetanus, or lockjaw, is a serious infectious disease caused by a toxin produced by the bacterium Clostridium tetani. This microorganism resides in soil, dust, street dirt, and plants. Infection occurs through wounds, cuts, or scratches when the bacteria enter the body. Symptoms of tetanus include muscle spasms and stiffness, which can lead to serious complications, including suffocation and death. Tetanus prevention is achieved through vaccination, which is typically administered in childhood and regularly updated throughout life. Cholera, also known as varicella, is a highly contagious viral disease caused by the varicella zoster virus. This virus is transmitted through airborne droplets, contact with the rash, or mucous membranes of infected individuals. It is characterized by the appearance of red, itchy rashes all over the body, accompanied by fever, fatigue, and general malaise. Chickenpox most commonly affects children, but can occur in adults, especially those who have not had the disease in childhood or have not been vaccinated. Vaccination is an effective method of preventing chickenpox, preventing the development of the disease or mitigating its course. Poliomyelitis, also known as infantile paralysis, is an infectious disease caused by the poliovirus. This virus is transmitted through contact with infected feces, as well as through droplets spread by airborne transmission. Most cases of poliomyelitis present without symptoms or with mild flu-like manifestations. However, in some cases, the virus attacks the nervous system, causing paralysis and sometimes even death. Poliomyelitis prevention involves vaccination, which is widely administered among children and has contributed to reducing the number of cases of this disease in many countries. Creutzfeldt-Jakob disease, CJD, is a rare but deadly non-inflammatory neurodegenerative disease that leads to rapid progressive brain damage. This condition is caused by the uncontrolled development of abnormal proteins called prions, which accumulate in the brain and cause damage to nerve cells. Individuals with CJD experience various symptoms, including rapidly progressive cognitive impairments, muscle weakness and coordination problems, changes in behavior and personality, as well as vision and speech problems. The disease typically leads to death within a few months after the onset of symptoms. CJD can be sporadic, hereditary, or acquired, for example, through contact with infected tissues or medical equipment. Currently, there is no effective treatment or vaccine for CJD, and the diagnosis is usually confirmed only after the patient's death during autopsy. Bovine spongiform encephalopathy, or mad cow disease, is a rare but deadly illness caused by the rabies virus. This virus is transmitted through contact with infected animals, usually through bites or scratches. Initially, the disease presents symptoms such as headaches, fever, and complaints of pain at the site of the bite. As the disease progresses, more serious symptoms develop, including agitation, delirium, muscle spasms, and paralysis. Ultimately, the disease leads to death due to the disruption of central nervous system functions. For individuals who suspect they may have been exposed to the risk of rabies infection, it is important to seek medical attention immediately and undergo appropriate vaccination and treatment. Rabies is a deadly viral disease that affects the central nervous system of mammals, including humans. The rabies virus is transmitted through saliva or blood of infected animals, usually through a bite or scratch. Individuals with rabies may experience various symptoms, including fever, pain at the site of the bite, aggression, restlessness, psychosis, and paralysis. After the onset of symptoms, the disease typically progresses rapidly and often leads to death within a few weeks. Thanks to preventive vaccination and post-exposure prophylaxis, rabies is rare in humans but remains a serious issue for animals in some regions of the world. Kuru is a rare non-inflammatory neurodegenerative disease caused by abnormal proteins called prions. This disease was widespread among the Fore tribe in Papua New Guinea as a result of cannibalism practiced by these tribes. Symptoms of Kuru include dementia, loss of muscle coordination, as well as muscle weakness and tremors. The disease progresses rapidly and usually leads to death within a year of symptom onset. Today, Kuru is very rare as the practice of cannibalism has been eradicated, but its study has helped expand our understanding of prion-caused neurodegenerative diseases and their mechanisms of development. Thank you, dear friends, for joining me on this fascinating journey through various deadly diseases. Don't forget to subscribe to our channel to stay updated on new videos about interesting events and facts. Until next time on the channel.